Good morning, everyone. The name of our lecture is Synapses and their function. What we are going to discuss today? We are going to discuss the general features of the synapses, classification of the synapses, anatomy of the chemical synapses and the mechanism of the synaptic transmission, the main physiological properties of the synapses, physiological characteristics of the neurotransmitters, and also the neuromuscular junction and its features. But before we are going to start, you should always give you for yourself ask yourself why I should start about this or that, why we should start about the synapses, what is so important in this small tiny thing, what is hidden behind this structure. To better understand the synapses, I would like you to show the video, and after that video we are going to continue.
About 50.
50. And is it rude to ask what age you are now?
64.
64. And
1995.
oh, I see. Okay. And did you have anybody in your family was affected by this?
Yes, the whole family.
The whole family were affected. Okay. So what age did you say you were when it started?
50.
50. 50. And that was the first time you noticed. And what's the first thing you noticed?
I was swimming on the ground and falling.
Falling
and dropping things.
and dropping things. So falling, dropping things. And what was the first one? Shivering, was it? Shivering.
Or dribbling.
Dribbling. Sorry, dribbling.
Or dribbling.
Ah,
dribbling.
sorry. Okay. Now, sometimes people with Huntington's have abnormal movements all the time. Sometimes they're less pronounced. And you have to watch closely to see this flexural extension of brother's back. He grinds his teeth quite a lot to try and overcome the orofacial chorea. Now, can you look at my finger here, please, and look up, and look down, and look right, and look left, all the way over to the door. That way. And to your right, head still. Well done. Left, right. I'm holding his head. Up high, look up high, and look down low. And there's a limitation as the condition goes on of eye movements. It's difficult enough to demonstrate, but abnormalities of saccadic eye movements or indeed progressive reduction in the range of eye movements can occur. Now, the other thing people notice is, can you open your mouth wide, brother, and stick out your tongue straight? Keep it out. Keep it out. Keep it out all the time. Don't let it back in. Come on. Keep it out as long as you can. But let's count to 3. Go. 1. 1. 1. Okay. And there's a difficulty with sustaining a movement. So as we see here with the right hand, if you don't mind, can you put your hand out straight in front of you, just your right for the moment, and close your eyes. Keep them there, and I want your eyes closed all the time. So hand out again. I'll kind of half support it here. Keep it there. And you can see the slightly writhing movements. Eyes closed when you can. I'm here now. Don't hurt yourself. Okay, now we try the left hand. If you put the hand out.
I'm Cheryl Hack. I'm 17 years old and I'm living with myasthenia gravis. I was diagnosed with myasthenia at 16 years old in October. I started having symptoms of having really bad weakness in my legs and arms and hands, and I'd noticed that my eyes started drooping and stuff, and it wasn't that bad, but then it started to get worse over time and stuff, and the more I was doing. And then while I was at school, I noticed that my muscles in my mouth and stuff weren't working right, and that when I was trying to eat or drink, that it was really hard to chew foods, and that the fluid in my mouth would just kind of fall out and my mouth wouldn't stay closed, so I would have to like hold it closed. And then when I told my mom, she of course got really concerned and took me to the doctor, and they didn't really know what was going on. But then my eyes started bothering me more, and I went to an eye specialist, and I went when my eyes were really droopy, and he said that I needed to be tested for myasthenia gravis, that's what he thought it was. And
Them up. Okay, and then go like that. And then take your right index finger and touch my finger right here, and then touch your nose. Go back here, back to your nose. Same thing with the right hand. Nose, back here.
Left-handed,
Okay.
yes.
Now,
Control
use
on the
your
right side.
left hand and just grab the this cup of water here, and take a sip. Okay, and put it back down. All right. Now, do you want to turn off your device?
Okay.
All right. And just give it a second there.
Stay ready.
You felt it? Bring your arms up like that and just hold them up. Okay, and then bend them just like that. Okay, take your right index and touch my finger right here, and then touch your nose back here. Okay, try the other hand, the same thing. Okay, nose back here. Okay, now try and grab the cup with the left hand and try and take a. Okay, put it back down. Okay.
So why I show you this short video? On this video, as you saw, that was presented for patients. The first patient had the disease which is called Huntington disease. The second patient has seizures. The third one has myasthenia gravis, and the last one, which is similar to some extent similar to the first patient, has the Parkinson disease. All these four diseases, the problems in all of these four diseases are located in the synapses. That is why it's for you, like a doctor, for the future doctors, it's important to know the structure of the synapses. The main function of them, what kind of neurotransmitter is released in that synapses, and what kind of effect it has. So in this case, if you will know the physiology of the synapses, it will be easier for you to know the pathophysiological mechanism of the diseases, and also what is very important for you, like a doctor, how to treat this or that kind of disease. That is why let us start first of all about the physiology, to learn what is the synapses, its structure, and then further we are going to stop on, I'm sorry, in a minute. So let us start to discuss about the synapses. What is a synapses? Synapses is a junction between two neurons, or between the neuron and the effector cell. Mainly the effector cell will be presented by the secretory cell of the muscle cell. How we can classify synapses? We can classify them in two variants. The first variant depending on the localization. It could be exoaxonic synapses, junction between one axon and another one, exodendric synapses, junction between the axon and the dendric of the nerve cell, or exosomatic synapses. It's a junction between axon and the somatic cell. Soma cell, in our case, it will be presented by the muscle cell or secretory cell. And another example of classification is depending on the signal transmission. Synapses could be electrical and synapses could be chemical. You see, even in the anatomical structure, these two types of synapses are different. About their differences, we are going to talk a little bit later. What are the main properties of synapses? The first one, it is one-way conduction law, synaptic delay, fatigue, summation, and facilitation. One-way conduction, what does it mean? It means that the signal in the synapses will be transmitted only in one way, from the presynaptic neuron to the postsynaptic neuron, only in one direction. Synaptic delay. During the transmission of the impulses via the synapses, there is a short delay in the transmission. Why the delay will happen? Due to the releasing of the neurotransmitter. It takes time to release neurotransmitter. The second of all, movement of the neurotransmitter from the axon to the postsynaptic membrane through the synaptic cleft. This period also will take the time and it will lead to the synaptic delay. And the last one, it is action of the neurotransmitter on the postsynaptic membrane, and as a result, the opening of the ionic channels in the postsynaptic membrane. Fatigue. During continuous muscle activity, the synapses forms the seat of fatigue along with the blood cells. The fatigue at the synapses is due to the depletion of the neurotransmitter substances like acetylcholine. Depletion of acetylcholine occurs by two factors. The first one is soon after the action. Acetylcholine will be destroyed by the specific enzyme which is called acetylcholinesterase, and it is a continuous action. New acetylcholine is not synthesized yet. Summation. Synapses require to release sufficient transmitters into the cleft, in the synaptic cleft, in order for enough of the transmitter to bind to the postsynaptic receptors. Mainly, the action of neurotransmitter on the postsynaptic membrane, it is example of the local response, or in other words, it's example of the graded potential. We know that the graded potential is described by the subthreshold stimuli, and as a result, it could not produce action potential. That is why, if we will summate this graded potential, if we will summate the subthreshold stimuli in a spatial way or a temporal way, this could lead to this summation will lead to production of the action potential. So we have two types of summation. It will be spatial summation and the temporal summation, which are different between the how they affect. The one effect on the same time, but in different places, and in another way, when we talk about, for instance, about the temporal summation, where it will occur when the signal presynaptic neuron fires many times in one place. Facilitation, it means when the presynaptic axon is stimulated with several consecutive individual stimuli. Each stimulus may evoke a large postsynaptic potential than that evoked by the previous stimulus. Consequently, another excitatory signal entering the neuron from some other source can excite the neuron very easily. So less or more we describe the main properties of the synapses. It is one-way conduction, it is summation, fatigue, facilitation, and synaptic delay. Now let us go on further. So let us talk more in detail on the classification depending on the transmission of the signals. As we talk, we could divide synapses on the electrical and chemical. What are the differences between them? Mostly electrical synapses will be located in the cardiac muscle, in the smooth muscles, in retina and olfactory bulb. Chemical synapses, they are located in the neuromuscular junction and mostly in the whole nervous system. Transmission of the impulses. In electrical synapses, it will be example of electrical signal, which will be transmitted by the ions. This type of transmission will be very fast. It's also depending on the anatomical structure of these synapses. Because in electrical synapses, we have a small synaptic cleft. Mostly it is in the size, it is about 2 nanometers. Also, the connection between presynaptic membrane with the postsynaptic membrane is connected through the specific channel, which is called gap junction channel. This channel is built of the protein which is called connexin, and through this gap junction channel, ion will transmit the electrical signal. In comparison to electrical synapses, chemical synapses. In the chemical synapses, these impulses will be transmitted by the chemical signal, which is example of the neurotransmitter, or another name it is mediator. Due to this, this kind of transmission will be slower, so speed will be very low. Why it's happening? Because in the chemical synapses, the synaptic cleft is very big. It's about from 20 to 30 nanometers. And as a result, it's need, if you remember, we talked about that there is a synaptic delay. So, and it also requires time to release neurotransmitter, to transport of this neurotransmitter to the postsynaptic membrane and to act on that postsynaptic membrane. That is why in this situation, the transmission will take a time, so the speed will be low. Also, if you remember, we discussed that one of the main properties of the synapse, it is one-way conduction. When impulse will be transmitted from the presynaptic neuron to the postsynaptic one. One-way direction is common for chemical synapses, but what is interesting, for electrical synapses, it will be common two-way direction transmission of the electrical signal. But in our body, we have small amount of electrical synapses. That is why mainly we will generally talk about the one-way direction of the signal in the synapses. In this picture, in this slide, you could see the differences in the structure of the synapses, not only in the words, but also in a picture. So, as you see in electrical synapses, we have specific channel, gap junction channel, which is built from the protein which is called connexin here. And in the chemical synapses, you could see that we have rather big synaptic cleft between presynaptic neuron and postsynaptic one. And in this synaptic cleft will release the neurotransmitters, which will bind to the postsynaptic membrane. Electrical synapses are mainly present in the cardiac muscles, smooth muscles, for example, of smooth muscles of the visceral organs, and the chemical synapses in the nerve system, in the whole nerve system. Electrical synapses, in this slide, you could see the more detailed structure of this connexin, which will build together the gap junction channels. And here you could see the example of the bundles of the smooth muscles and the electrical channels between the fibers of the smooth muscles. So, connexin, as we discussed, it's linked to cells by forming molecular tunnels or molecular channels between them. Electrical synapses are good for communication, and the signal here will be transmitted very quickly, rapidly. The same, one more example, one more picture to see in detail how this electrical synapses is built. Here you could see this gap junction, which is built from one connexin, for example, and here's the second one. And ions will be transmitted through this channel. Here you could see example of the cardiac muscle, and where is located the electrical synapses between fibers of the cardiac muscle. Here's example. So wave of depolarization will spread rapidly over the atria due to the gap junction. So mainly the electrical synapses will produce in this atrium, and then through these intercalated discs, through these electrical synapses, the impulse will be transmitted through the whole conductive system of the heart. The transmission will happen very quickly, immediately, rapidly. That is why heart will always contract. I'm sorry, due to the always stimulation of the electrical stimuli, and it never will stop. Chemical synapses. You could see that the structure of the chemical synapses is more complex. Here is an example of the presynaptic neuron 1. Inside of the presynaptic neuron, you could find the synaptic vesicles, which are full of the neurotransmitter, which further are going to release in the synaptic cleft. You see here, the ion composition of synaptic cleft is the same as the ion composition of the cell. It means inside the cell of its environmental is the same as the ion composition of the cell. It means it will have higher level of potassium and low level of sodium, and this neurotransmitter will bind with the receptors of the postsynaptic membrane. This will lead to the opening of the ligand-gated channels, and as a result, due to the opening of the ligand-gated channels, will be produced the postsynaptic potential and transmission of the nerve impulse. Now let us discuss one by one what will happen in the chemical synapses. First of all, we have the nerve impulse. This nerve impulse will be transmitted through the whole axon, and as a result, this impulse will be responsible to open the calcium channel. So the second stage, it is open the voltage gated calcium channel. Calcium will enter the presynaptic neuron, and it will bind to the synaptic vesicles, and it will be responsible to release the neurotransmitters. So the third stage, it is releasing of the neurotransmitters from the presynaptic neuron. The fourth stage, it is connection of the neurotransmitters to the postsynaptic membrane. The fifth one, it is opening of the ligand-gated channels. The sixth one, it is the production of the postsynaptic potential, which could be excitatory or inhibitory. We are going to discuss about this later. And the seventh stage, it is transmission of the nerve impulse. Now let us repeat once more all these stages. So here you have example from the microscope picture of the chemical synapses. So as I told, now let us repeat once more all stages of the transmission signal in the chemical synapses. The first stage, action potential arrives at the presynaptic membrane, and voltage-gated calcium channel in the presynaptic membrane will open. Calcium will enter the presynaptic neuron. Voltage-gated calcium channels are found on the presynaptic membrane and nowhere else on the neuron. Second point, calcium ions will cause synaptic vesicles to fuse with the presynaptic membrane and release neurotransmitter into the synaptic cleft. The third stage, neurotransmitter will diffuse to the synaptic cleft and binds to the specific receptors on the postsynaptic membrane. So they are released here, neurotransmitters, and binds to the receptors on the postsynaptic membrane. Next stage, neurotransmitter bind to the ligand-gated ion channels. So if they bind to the ligand-gated sodium ion channels, Sodium will diffuse to the postsynaptic through the postsynaptic membrane inside the neuron, and it will cause depolarization, which could initiate the action potential. And as a result, this action potential will be transmitted further. Now let us return back to the level when the will transmitted impulse. Next question is, what will happen with the neurotransmitter? So, as it connected to the postsynaptic membrane and as ligand-gated channels open and sodium, for instance, in this case we discuss only about sodium, will enter the cell. So logically, no impulse will appear. Mostly action potential will appear, and which will be done by the first stage of the depolarization. But what will happen with the neurotransmitter? The neurotransmitter could not act for the whole period of time. So it should stop its action. It should stop its effect. So how this will happen? Inactivation of the neurotransmitter is happened in three ways. The first way, it is when the neurotransmitter will return back to the presynaptic neuron, and it will be used for resynthesize of that neurotransmitter. The second stage, when the neurotransmitter will be destroyed by the specific enzyme, and the third stage, when the neurotransmitter will diffuse out of the synaptic cleft. So, three ways how we can inactivate neurotransmitter. It's returning back to the presynaptic cell and resynthesize of neurotransmitters. It is destroying by the enzymes, and it is diffusion out of the synaptic cleft. This process is very important because if we will destroy or if we will inactivate neurotransmitter, the action, the postsynaptic potential will not appear. So we will stop action of the neurotransmitter, and as a result, we will stop transmission of the nerve impulses in the postsynaptic neuron. As we talked that the neurotransmitter is bound to the receptors on the postsynaptic membrane, and it is responsible for opening of the ligand-gated ion channels. Due to the opening of ligand-gated ion channels, different kinds of ions could enter the cell. For instance, if sodium will enter the cell, we will receive depolarization, and as a result, depolarization will lead to transmission of action potential through the nerve impulse, through the neuron. In this situation, we will name the excitatory effect of the neurotransmitter. But sometimes neurotransmitter is responsible for open ligand-gated ion channels through which will enter chlorine ions, and chlorine ions will lead to the will have inhibitory effect on the postsynaptic membrane. Inhibitory effect of the postsynaptic membrane means that none kind of impulse transmission will happen, so nothing will happen. So we will have inhibition of the postsynaptic membrane. So that is why we could say that the synapses can be as excitatory or inhibitory. Mostly the synapses between motor neurons and muscle cells, they're excitatory, and they're responsible for contraction of the muscles. But nevertheless, we are going to talk also about the inhibitory synapses. Between the motor neurons and neurons, if the postsynaptic responsible in hyperpolarization, we are going to receive the effect inhibitory effect, which means stop of transmission of the which means that the nerve impulse will not be transmitted. So postsynaptic potential can be excitatory in case if sodium will enter the cell and responsible for occurring of depolarization and transmission of action potential. Or postsynaptic potential can be inhibitory In case when the chlorine ion channels will enter the postsynaptic membrane and action potential will not transmit it. It means no impulse will not transmit it through the neural cell. So you could see here in excitatory postsynaptic potential, we have threshold stimuli for firing action potential, and sodium will enter inside the cell. In inhibitory postsynaptic potential, we have situation in which chlorine ion channels will enter the cell and responsible for appearing the hypopolarization state. Excitatory postsynaptic potential is a local graded depolarization of the postsynaptic membrane. If this depolarization reaches the threshold, the cell produces action potential and conducts it along the membrane. Inhibitory postsynaptic potential, it is the same local gradient hyperpolarization. So what is important for you to remember that excitatory postsynaptic potential and inhibitory postsynaptic potential, it's example of the gradient potential. It's example of the local response. In this situation, in the inhibitory postsynaptic potential, in case of the hyperpolarization, it will move the membrane potential further from the threshold and decrease the likelihood of production of the action potential. So the nerve impulse will not be transmitted. Neurotransmitters affect the postsynaptic potential membrane. This effect depends on the amount of the neurotransmitter which is released, and also this effect depends on the time the neurotransmitters is bound to the receptors. So in this situation, we could talk about how many neurotransmitters and the time. We are going to talk about the summation of the subthreshold stimuli. Summation of this stimulation, which in further could fire the action potential. What kind of summation we have? We have spatial summation and temporal summation. Spatial summation means when two or more impulses will arrive in different places at the same time. So when a lot of impulses will arrive in the same time, this will be responsible to fire the action potential. And temporal summation means when two or more impulses arrive in a rapid succession in the same place. So due to this summation, due to temporal summation, we also could receive the action potential. When they are summed together, they will fire the action potential. So in this slide, you could see example about the spatial summation when the two stimuli in different places but at the same time will effect on the neuron, or temporal summation when several impulses from one neuron will arrive in the same time. Nevertheless, or during the temporal or spatial summation, they together are responsible for occurring of the action potential, which will travel along the axon. Summation mainly occurs in the axon hillock. Here is this place which is the part from which is a part of the nerve cell. In the axon hillock will appear the situation of the summation. Then let us go on. So the same situation you could in this slide you could once more repeat different kind of the summation: temporal summation and the spatial summation. Now let us go into the neurotransmitters. So we discovered that the neurotransmitter could produce different kind of potential on the postsynaptic membrane, or excitatory postsynaptic potential or inhibitory postsynaptic potential. Now let us discuss what kind of neurotransmitters we have. We can classify neurotransmitters in a chemical groups. We have 6 chemical groups, or we could classify them like in a functionally, or the excitatory or inhibitory. So we discuss about excitation and inhibition. Now let us talk more in detail what neurotransmitters, what kind of effect will produce. So what chemical groups we have? We have choline derivatives like acetylcholine. We have amines, example, it is the adrenaline, noradrenaline, dopamine, serotonin, histamine. We have amino acids like GABA, glycine, glutamate, aspartate. We have peptides, it's a substance P, enkephalins, endorphins, somatostatin. We have nucleoids and their derivatives, it's like ATP and adenosine. And we have soluble gases, it's nitric oxide or carbon monoxide. What is interesting is that sometimes one neurotransmitter, but in the different places, could produce different effects. For example, acetylcholine has as excitatory as inhibitory effect. It depends on the place or localization where it will effect. For example, in the central nervous system, it mainly will have the excitatory effect. In the autonomic nervous system, it could have the inhibitory effect. So, functional classification of neurotransmitters, it is excitatory neurotransmitters. For instance, glutamate, it's only excitatory neurotransmitter, or inhibitory neurotransmitters. For instance, GABA or glycine, they mainly have inhibitory effect. They could not be they could not have inhibitory and excitatory effect together. Some neurotransmitters, as I told you, have both excitatory and inhibitory effect. Determined by the receptor type of the postsynaptic neuron. So, excitatory effect at the neuromuscular junction. Acetylcholine could have excitatory effect in neuromuscular junction and inhibitory effect in cardiac muscle. So it's a part in this situation, acetylcholine, it is a part of the autonomic nervous system, and through this system it will have inhibitory effect on the cardiac muscle. At the same time, neurotransmitter when it binds to the postsynaptic to the receptor of the postsynaptic membrane, it have two types of mechanism of synaptic transmission. It could be inotropic mechanism or metabolotropic mechanism. In case of the inotropic mechanism, neurotransmitter will bind to the receptors of the postsynaptic membrane. The ion channel will open and ion will flow inside of the cell. So this type of transmission is rather easy and very fast. In comparison to the metabolotropic mechanism of changing the charge of the postsynaptic membrane, it is more complicated because in this situation, neurotransmitter should bind to the receptors of the postsynaptic membrane. Also, it will activate G protein. This G protein have several subunits, alpha, beta, and gamma. These subunits are going to activate, or subunit will move to adjust ion channel. And as a result, when they adjust ion channel, only in this situation, they will be responsible to open the ion channel, and only then ion will flow inside the cell. So this type of synaptic transmission, metabolotropic, is rather long. It's take a time. It requires secondary messengers like G proteins, and it will be slowly in comparison with inotropic mechanism for synaptic transmission. So here let us compare the inotropic and metabolotropic mechanism of synaptic transmission. As I told you, in inotropic variant, ion channel will open and ion will flow inside the cell. This kind of effect will be very fast. and the change, and it will very quickly change the charge of the postsynaptic membrane to the depolarization or hyperpolarization state. The example of such neurotransmitters will be glutamate, glycine, and GABA. In metabolotropic mechanism, as I told, it requires a secondary messengers. It is like G proteins which should activate it, and only due to the activation of the secondary messengers, the ion channel is going to open and allows ion to flow inside the cell. This type of this mechanism of synaptic transmission will take a time, so it has a slow effect. It requires seconds and minutes. Example of such kind of its effect on the postsynaptic, its effect on the postsynaptic metabolism. So it means it requires energy, calcium, calcium, and the example of such of neurotransmitters, it is the monoamines, neuropeptides, and others. Example of the example of the neuropeptides we discussed, it will be enkephalins, endorphins. Example of the amino acids will be couple we discussed would be noradrenaline, adrenaline. And dopamine and serotonin. So now let us look here to this table, which describes several neurotransmitters, the effect of the neurotransmitters, and what kind of diseases they could lead if we will have lack of them or we'll have a huge amount of them in our nervous system. So acetylcholine. It have excitatory effect in the central nervous system, in the neuromuscular junction, and also but it could have excitatory or inhibitory effect in the autonomic nervous system. In case if we have large amount of acetylcholine in the central nervous system, it will lead to such kind of diseases like Huntington disease. You saw in a video the example of the Huntington disease, when the person could not sit straight, he always move, it's uncontrolled movement, and Alzheimer's disease, during which the person have problems with the memory, is memorizing. Dopamine. Dopamine mainly will have excitatory effect in central nervous system. The lack of dopamine will lead to the Parkinson disease and schizophrenia. GABA. Mainly they have inhibitory effect in the central nervous system, and the lack of it will lead to the epileptic seizures. Serotonin. Mainly it will have inhibitory effect in the central nervous system. The main function is responsible for such feeling, for good feelings, for feelings of happiness, pleasure, and the lack of the serotonin will lead to the depression or anxiety. Now let us stop in several neurotransmitters more in detail. The first one is the acetylcholine. So this is the first neurotransmitter which was identified in the best way. Acetylcholine doesn't matter in which kind of synapses, or neuromuscular synapses, or in other synapses in the central nervous system. It will destroyed by this specific enzyme which is called acetylcholinesterase. This acetylcholinesterase is going to inactivate acetylcholine, and as a result it will not produce any kind of effect on the postsynaptic membrane. I advise you to, my advice is for you is to remember about this acetylcholinesterase enzyme which inactivates the neurotransmitter, because further we are going to stop on this enzyme more in detail. Acetylcholine bind to the acetylcholine receptors. What kind of acetylcholine receptors we have? It is nicotinic receptors and muscarinic receptors. Mostly nicotinic and muscarinic receptors. Mostly nicotinic receptors will be found in the neuromuscular junction, and muscarinic receptors will be found as part of the autonomic nervous system in the visceral organs. So nicotinic receptors, it's responsible, the acetylcholine will bind to them, to the nicotinic receptors, and as a result will directly open the ion channel and produces the depolarization of the postsynaptic membrane, which means entering the sodium channel, production excitatory effect, which will lead to the depolarization and transmission of the external potential through the nerve cell. Muscarinic receptors, they mainly have the slow acting. Why? Because in this situation, acetylcholine will bind to the muscarinic receptors, and the mechanism of synaptic transmission will be metabolotropic. It means it will require the G protein or secondary messengers, which will be responsible for opening the ion channel. So the transmission of impulses in this variant will be slowly in comparison with the with the previous one, where we have nicotinic receptors. Why these receptors were named muscarinic? Because such structure like amantia muscaria, which was found in the mushrooms, bind also to these receptors, and due to the binding to these receptors, it will lead to such symptoms like intoxication, dizziness, difficulty walking. So it means when the person will eat poison mushrooms, which contain this muscarine, it will bind this muscarine to the muscarinic receptors, and it will lead to these symptoms, which could durate about 30 minutes to 2 hours. And mostly it will brings a lot of discomfort for person. The next neurotransmitter which we're going to discuss, it will be norepinephrine, or another name it is noradrenaline. It's main neurotransmitter of the synaptic branch of the autonomic nervous system. This neurotransmitter have as excitatory or inhibitory effect depending on receptors to which it will be bound. It's this also neurotransmitter in the central nervous system responsible for attention and arousal, and and as a result, person is going to have really good feelings of pleasure. And its release is enhanced by the amphetamines. So the people who take such drug as amphetamines, they will have the release of norepinephrine, which will increase the effect of feeling good. So if I am nervous, you should blame your neurotransmitters. You should blame the norepinephrine, you should blame serotonin, dopamine, and GABA. Yes, it's rather weird. You know that the serotonin and dopamine, this is two neurotransmitters which is also responsible for the feeling good, for feeling pleasure, for feeling happiness, the same as the norepinephrine. GABA have the inhibitory effect. But nevertheless, when we have a huge amount, when we have increased effect of these neurotransmitters, they will lead to the condition of the nervous condition. Or if we have the lack amount of the serotonin or dopamine, it will lead person to the condition of the anxiety or depression. Noradrenaline bind to such receptors as alpha-1, alpha-2, beta-1, beta-2, and also there is a beta-3. Mostly noradrenaline will, the mechanism of synaptic transmission will be metabolotropic. It means it requires secondary messengers to open the ion channels in the postsynaptic membrane. This type of receptors we could find in the smooth muscles of the heart, in the smooth muscles of the other visceral organs like gastrointestinal system, urinary system. Amphetamine and nicotine are stimulants, and they are responsible to enhance releasing of the neurotransmitter as norepinephrine and also dopamine. So as a result, they will be responsible for increasing the good feelings. Now, dopamine causes neurons to fire more often than normal. So you are going to have such kind of euphoric feelings. But when the effect will wears off, person will feel down. So in case that is why they need to more amphetamines, they need to increase the dosage, and by increasing of the dosage the person will feel more euphoric, but at the same times when the effect will drop down, the person will feel worse every time, worse and worse. So here you could see the effect of the amphetamines of the person who takes this drug. You see that she doesn't look very good by the ages. So as we discussed, that the amphetamines also stimulate the dopamine synapses and releasing of the dopamine from them. Now let us go to another synapses. So I'm sorry, to another neurotransmitters like substance P and enkephalines. These two types of synapses with a part of the pain and nociceptive system and antinociceptive system. Substance P mainly are responsible, it have excitatory effect and is responsible for production of pain, for transmission of impulses of pain. Enkephalines and enkephalines and endorphins, they mainly have inhibitory effect, and they are a type of, and they're responsible to relieve pain, to decrease pain sensation. So they're a type of antinociceptive system. So these two neurotransmitters are responsible for transmission of pain or for decreasing or relief of the pain. Serotonin, as we have the slide which describes if you're nervous, blame this neurotransmitter. Serotonin is that neurotransmitter which is responsible in a healthy condition to maintain the good feelings, to maintain the pleasure. But in case when the person will have the lack of the serotonin, in this situation, the person will feel depressed and anxiety, and also she also could in the further could feel more nervous. So in this picture you could see that in a healthy synapses we have a huge amount of serotonin which connect to the postsynaptic neuron, and in a synapses of depressed person we have a lack amount of serotonin. How we can deal with this situation, how we can help person with a depression? So our aim to help person with a depression is to increase level of serotonin. How we are going to increase level of serotonin? By knowing the mechanism of the inactivation of the serotonin. In a physiological way, mostly serotonin is responsible for transport, for returning back to the presynaptic neuron. We have specific serotonin transporter, it's specific proteins, which will be responsible to transport back serotonin to the presynaptic terminal and to use it for further synthesis, for further production of serotonin. That is why people who have depression will take a specific drug which is called selective serotonin reuptake inhibitors. These selective serotonin reuptake inhibitors will block these proteins, and as a result, serotonin will not return back to the presynaptic terminal. It's going to stay in a synaptic leaf, and as a result, is going to continuously affect on the postsynaptic membrane. So in this situation, we are going to deal with a disease like depression. We are going, in this situation, serotonin will stay in a synaptic cliff. We will have continuous, permanent appearing of it in the synaptic cliff, and will have a permanent effect on the postsynaptic membrane. And this will lead to increase the mood of the person, to reduce anxiety, to reduce depression. The example of such drug, it is the Prozac and Zoloft. So this drug, Prozac and Zoloft, they will block serotonin reuptake. They will inhibit selective serotonin proteins, which are responsible for reuptaking of it to the presynaptic terminal. If you're drunk, you could blame the GABA and dopamine. Why GABA? GABA mainly have the inhibitory effect on the nervous system. So in this situation, when the person is drunk, the inhibitory processes will be more common, and it's difficult for person to think, to make very quickly and logical action. And also alcohol will enhance releasing of the dopamine, and as we discussed previously, dopamine is that neurotransmitter which is responsible for good sensation, for pleasure, for feeling good. So you're going to feel good, you're going to be the person is going to feel good, to have pleasure, but to make some kind of moment, to have some kind of quick reaction, it will be very difficult due to the increased effect of the GABA. But at the same time, GABA as inhibitory neurotransmitter in the central nervous system, it's also responsible for appearing of such kind of disease which is called seizures or epilepsy. So in a normal synapses, presynaptic neuron will release GABA, and GABA will have inhibitory effect on the postsynaptic membrane. It's in a physiological or healthy condition. But in a condition of the epilepsy, it means when a person has seizures or epilepsy, it has in the central nervous system, mainly in the brain, in the cerebral cortex, the excitatory process will be increased. And this excitatory process or excitation, which will be spread along other synapses and another neurons, will not be inhibited. Due to this, the person is going to have the chronic stage of the epilepsy. It means, as you saw in the previous video, it's involuntary muscle contraction, and also a person could lose the consciousness. So why does it happen? As I told you, it happens because in the central nervous system, in the cerebral cortex, we have huge amount of excitation, which normally should be inhibited by the GABA. But as we have a lack of this GABA, inhibitory effect will not be such good. So, and this fire of excitation will lead to the clonic clonic phase of the epilepsy. It will lead to the it will lead to a condition when the person is going to lose the consciousness. How we can help the person with the epilepsy or seizures? How we can increase the level of GABA in the synapses, or how we can affect the postsynaptic membrane? So the drug which is used to treat the epilepsy are called barbiturates. Certain GABA receptors are ligand-gated channels that allow chlorine channels in flow inside of the cell. GABA produces, as we discussed, inhibitory effect. It has a hypoparesthetic effect on the postsynaptic membrane. Barbiturates enhance the bindings of GABA to the receptors. So barbiturates will help that small amount of GABA which are present in a person with a seizures to bind to the receptors, resulting in a prolonged inhibition of the postsynaptic membrane. So they like such kind of bridge which will help connection of the GABA to the postsynaptic membrane. As a result, the channel is going to be open, and it will lead to influx of the chlorine ion to the postsynaptic membrane. This kind of drug has a sedative effect on the person, and it will lead to decreased level of the epilepsy. So now let us go on to the neuromuscular junction and discuss about its structure. Neuromuscular junction is a connection between the neuron and the muscle cell. Mostly the muscle cell will present the muscle cell of the skeletal muscles. Be attentive, not smooth muscles, skeletal muscles. So the mechanism of transmission mainly is the same. The action potential will spread along the axonal terminal. As a result, it will be responsible to open calcium channel. Calcium will influx the terminal, bind to the synaptic vesicles, which allows synaptic vesicle to release neurotransmitter acetylcholine in the synaptic clip. In the neuromuscular junction, be attentive, we have neurotransmitter which is called acetylcholine. Acetylcholine is going to bind to the N-cholinereceptors. Be attentive, N-cholinereceptors. It means nicotinic receptor. In a neuromuscular junction, we have only nicotinic receptors. Due to this binding, ion channel are going to open through the ionotropic mechanism of the synaptic transmission, and it will be responsible for entering of the sodium channel. So acetylcholine in the neuromuscular junction have excitatory effect. It means it will be responsible for production of excitatory postsynaptic potential due to the entering sodium channel inside the cell and production of the depolarization. So the main points which you should know about the neuromuscular junction. It's a junction between nerve cell and the cell of the skeletal muscles. The neurotransmitter which is present here, it is acetylcholine. Acetylcholine binds to the nicotinic receptor of the postsynaptic membrane and is responsible for production of the excitatory postsynaptic potential. Excitatory postsynaptic potential means that through the ligand-gated channel will enter sodium, which will be responsible to produce depolarization. So the disease which is common for the neuromuscular junction, it is the myasthenia gravis. If you remember in the video, it was there was shown the girl who has the myasthenia gravis. She complains on such complaints that it was difficult for her to swallow the food. She has the symptoms of the dysphagia. She had the problems with her vision, drop of the eyelid, and also double vision. And also another symptom, it is the muscle weakness. It was difficult for her to move. So why this disease has happened? Myasthenia gravis is an example of the autoimmune disease during which antibodies will bind to the nicotinic receptors of the postsynaptic membrane. When these antibodies are binding to these receptors, they will block connection of acetylcholine to the nicotinic receptors. So it means that the acetylcholine will not be able to connect with the postsynaptic, with the nicotinic receptors, and as a result, it could not release the excitatory effect. That is why the person has the muscle weakness. It means muscle will not be excited, fully excited by the acetylcholine. Excitation will be very low and the muscle contraction is going to be reduced. the person is going to feel the muscle weakness. How we can help a person with these diseases? To understand the pharmacological stage in this situation, we need to return back to inactivation of the neurotransmitter. If you remember, we discussed that the acetylcholine is that neurotransmitter which is inactivated by the enzyme acetylcholinesterase. So how we can treat the myasthenia gravis? Yes, as we discussed, that the acetylcholinesterase is that enzyme which is going to destroy acetylcholine. In case of the myasthenia gravis, when the receptors are blocked by the antibodies, some of the receptors are blocked of the antibodies. Those receptors which are not blocked with antibodies are open. They could connect with acetylcholine. That is why it's important to increase lifespan of the acetylcholine. So, in case of the myasthenia gravis, are going to be used drugs which is going to inhibit acetylcholinesterase. As a result, acetylcholinesterase will not inactivate acetylcholine, and acetylcholine, to some extent, in a permanent way, is going to affect on the nicotinic receptors. Nicotinic receptors and stimulate the postsynaptic membrane, stimulate the muscles for better contraction. The example of such drug, it is neostigmine or prozerine. These two types of drugs are inhibitors of acetylcholinesterase, inhibitors of that enzyme. What medicine we could use in the cases of surgery operation and in cases for anesthesiologists for intubation? Yes, in this situation we need the relaxed muscles, because we could not intubate person if the muscles will not be relaxed. Why? Person is going, the skeletal muscles of the neck, of the head, they're going to resist intubation, and it will be difficult to make this procedure. Also, it will be difficult for making the surgery operation, to cut the skin and the muscles during it. We also need the relaxation of the muscles. So what kind of drug we are going to use to relax the muscle during the surgery and the intubation? This type of drug will be called neuromuscular blockers or curare. What this drug are going to do? This drug are going to block ancholinereceptors, nicotinic receptors. As a result, if we will block nicotinic receptors, acetylcholine will not bind to them. Also, it will be destroyed further by acetylcholinesterase, so we will not receive the excitatory effect on the postsynaptic membrane. The example of such drugs are called atropurium or succinylcholine. These drugs are neuromuscular blockers, which will block nicotinic receptors in the postsynaptic membrane. Another type of drug which is used, but they are going to block M cholinereceptors. Be attentive, M cholinereceptors, muscarinic receptors. It is atropine. Mostly we receive atropine from the such plant like belladonna. So atropine is going to block muscarinic receptors, which mainly present in autonomic nervous system. Due to the blocking of muscarinic receptors, acetylcholine will not bind to the receptors and the effect will not release. Mostly in the autonomic nervous system, acetylcholine, when bind to the muscarinic receptors, it will be responsible for constriction of the pupil. But in case if we will block this muscarinic receptors and will not allow acetylcholine to bind them, it will be responsible for dilatation of pupil. Block acetylcholine receptors, will not contract, and we will have dilatation of pupil. In this slide, let us discuss once more diseases and the chemical agents that affect on the neuromuscular junction. alter release of the acetylcholine. So we could block release of the acetylcholine. What chemical agent could block also release of the acetylcholine? Clostridium botulinum toxin. It's a toxin due to the food poisoning, mostly when you will eat a can, when the person will eat the can which is went off the period of the went off, and it's when it will not be good for eating. Block of calcium channel in the presynaptic terminal. This will happen during this disease which is called Lambert-Eaton syndrome. The symptoms will be very similar to the myasthenia gravis, but in case of myasthenia gravis, we have the blocking of the we have block of the nicotinic receptors of the postsynaptic membrane by the antibodies. But in the Lambert-Eaton syndrome, the very important key point is the cancer in the lungs, which is not common for myasthenia gravis. Black widow spider venom will be responsible for cause of explosive release of acetylcholine, which could lead to the explosive release of acetylcholine, which could have effect as on the autonomic nervous system. It means on the muscarinic receptors and also in nicotinic receptors, mostly. Now let us go on to another neurotransmitter, but before this, let us answer to the very simple question. Is it simple to raise a hand? Yes, for us it's rather simple to raise a hand, but in your core cerebral cortex we have very complex or it's better to say the sequence of events to raising the hand. First of all, when you would like to raise your hand, you will you will modulate how it's going to be by your frontal cortex. Secondly, this information will be sent to the motor cortex. Motor cortex, first of all, will send information. Then motor cortex is going to send information to the basal ganglia. Basal ganglia is going to precede you this movement, how it should happen, movement of the hand, and the information back through the thalamus will send back to the motor cortex, and only then motor cortex will send information to your hand, and you're going to raise your hand. So to raise your hand, you need to connection of the three and more structures. It's a connection of the motor cortex, it's a connection of the basal ganglia, which will modulate your contraction, how it's going to be, to make your contraction in appropriate weight, to make your contraction of the muscles coordinative, and only then when we proceed you how it's going to be through the thalamus, information will send back to the motor cortex, and motor cortex is going to send through the spinal nerves information to your hand, and only then you will raise your hand. Why I explain you such some extent difficult mechanism? This type of mechanism is very important in case when we talk about the Parkinson's disease and releasing of such neurotransmitter, which is dopamine. We discussed that the dopamine is a neurotransmitter which is responsible for such feeling, having such effect in the central nervous system, and it's responsible for such effect like feeling good and feeling pleasure, but also it is a part of the basal ganglia. Most it is a part of the substantia nigra, and it have also excitatory effect in the central nervous system, in central nervous system, and it's responsible for coordination of it's released by the substantia nigra in basal ganglia, and it take part for making your movement coordinative, for making your movement appropriate. So in a healthy neuron we have sufficient amount of the dopamine, which will bind to the receptors on the postsynaptic membrane, and the movement will be appropriate, the movement will be coordinated. In case if we have lack of dopamine in the substantia nigra of the basal ganglia, less amount of dopamine will bind to the neurons or postsynaptic neuron, and the movement is going to be and as a result we are going to receive movement disorders. The movement will not be coordinated. If you remember the video where the person was sitting on the chair and he has a shivering of the hand, the shivering of the hand is called the tremor. It means that the movement of the hands person will not coordinate. This happened due to the lack of the dopamine. So how we can help the person with the Parkinson disease, with the shivering of hands, with this tremor? We could help them with a drug which is called levodopa. Levodopa it's responsible to have the similar effect of the dopamine, and as a result it will try to connect to these receptors on the postsynaptic membrane and try to make your movement more coordinated. Okay, it's lesson more which we discuss about the neurotransmitters. I also like to return back to the neuromuscular junction. The postsynaptic membrane of the neuromuscular junction is a modified part of the muscle cell, and it's going to name like a motor end plate. So the postsynaptic membrane is going to name like a motor end plate. Here it's located, and in this I'm sorry. And in this motor end plate could appear miniature end plate potential. This potential are generated at the motor end plate in a resting state due to the random fusion of acetylcholine containing vesicles through the vesicles of the presynaptic neuron. This acetylcholine will diffuses to the motor end plate and will cause localized depolarization of the motor and plate of about 0.5 millivolts. So it's like small local response in the muscle cells, because mainly that acetylcholine when it is released from the vesicles in the due to the nerve impulses from the presynaptic neuron, it will be responsible for production of the action potential. In case of the miniature and plate potential, this situation will happen in the resting state. I hope you less or more understand the lecture. Thank you for your attention, and goodbye.